I want to thank all of you for joining us today. I think one of the strengths of Healthy People is that it reaches all sectors of society, and we are thankful to have you to explain in your own way how Healthy People has impacted the work you have done to improve the health of our nation in your particular area. So, Dr. Engel, let me start with you and ask, how has Healthy People been used in the state of North Carolina?
Well, it's great to be here, Penny, and thanks for inviting me. We started back in the 90s when this initiative was just began in the country. North Carolina at that time had the worst infant mortality rate in the nation. We ranked 50th. And at that time, a group of stakeholders led by the then Governor Jim Hunt decided it was time to take matters seriously at his level and began the Healthy North Carolinian objectives and goals at that point in time, but it was really focused in the 90s on our infant mortality problem. But I'm pleased to say that he wrote an executive order, and that was just refreshed by our present governor, Governor Beverly Perdue, in 2009. So for the last 20 years, we've had a governor-level Healthy People initiative in our state. I'm also pleased to say that we're no longer last in infant mortality, and I think some of these initiatives that we initiated at the local level really moved the needle on that problem. We still have a long ways to go, but it's these initiatives and these sharing of health data across the entire community that has enabled North Carolina to have such a success and to keep it going for 2020. And finally, I have to say that this does take governor-level buy-in. I can't do it alone as a state health director. Public health cannot do it alone. No. We can point out the problem, we can measure the problem. In fact, that's an essential service of public health, is to measure health data. But getting things done is going to require all aspects of government at the federal, state, and local level. So in North Carolina, having the governor's leadership has been crucial to us.
Thank you. And I think we all will agree that having the leadership at the top makes it a lot easier for all of us. Rita, how in Sonoma County, California, has that kind of leadership helped you use Healthy People?
Well, thank you, Penny, for inviting me. And Sonoma County in Northern California has been paying attention to health indicators and working with our community for many, many years. We believe that to improve health at the community level, all communities need to have access to information, and they need the tools to make data-driven and evidence-based decisions. So the county, through the leadership of the Board of Supervisors, made available investments in a program that's called Network of Care for Healthy Communities, and it provides that data. It's the local delivery platform for information, and I think you see it behind me. It provides data, local health data, other data, and health and human services programming and information and other content. In our community, there's a great interest in reduction of tobacco, and we all know that exposure to secondhand smoke is the 6th leading cause of death in the United States. So this interest and passion within our community, our cities, and local governments has really driven our interest and utilization of Healthy People 2010 and now Healthy People 2020 tracker to be able to monitor and, as Dr. Engel said, track how Sonoma County is doing. You'll see that we actually, I believe it's circled behind me, meet the standard and have met our target, but that doesn't tell all of the story. You can drill down, and the community and interest groups and our health professionals and all of our partners can click on the Healthy People 2020 tracker. I'm going to have to get used to saying 2020 tracker. And you can see that we get more detail and more information and trend data, such as information about age, sex, race. And that really helps the local health jurisdiction to make sure that we're meeting all of the needs within our community. Additionally, we want to use the tracker and the information to help push policy and agenda. And we do that by using some of the community health guides, best practices, and we're also able to list the information that we're using here in our community so that groups can adopt best practice and make sure that we're aware of their agenda and how what we're involved in and the policies that are coming forth to cities and counties are reflective of the action they want to take.
Thank you, and my hope is that many, many hundreds and thousands of counties all over the United States will be able to achieve this kind of dashboard so that citizens are able to access health information in such a great way. Dr. Riegelman, can you describe the Education for Health framework and why you believe it is so important to advancing the goals and targets of Healthy People 2020?
I've had the privilege of co-chairing the Healthy People Curriculum Task Force, which began, interestingly, out of a Objective 1.7 of Healthy People 2010. Now, I assume you've all memorized all the objectives in 2010, but just in case, Objective 1.7 encouraged the development, the great expansion of prevention education as part of clinical education. And to make that happen, Association for Prevention, Teaching, and Research convened a task force made up of clinical health professions, medicine, nursing, pharmacy, dentistry, physician assistants, and the associations for schools of allied health professions. And together we actually sat down and talked about what that would mean. And perhaps our biggest accomplishment is actually developing a common language so people could talk to each other, a precondition to, I think, making real progress. And we developed what we call the Clinical Prevention and Population Health Framework. And that framework has provided us with the starting point to really make some real coordination, collaboration, and connections in the health professions. So we developed a framework that has 4 components. One looks at evidence-based practice, a key ingredient. A second, clinical prevention and health promotion. Third, health systems and health policy, which we all know are becoming increasingly essential to public health. And finally, population health and clinical aspects of practice, community aspects of practice. And that's clearly a framework that's, interestingly, it has now been widely distributed, widely used in the professions, and for us the ultimate achievement is to hardwire it to the accreditation. And that has now been done in both nursing and in pharmacy, and we hope to see that happen in many of the health professions, because that's, we think, is the key. To really make this a part, not a tag-on, not an incidental, not a nice thing to do, but a core component of health professions education in public health, in clinical health, in individual and in population. So we think we've really made some success in there, and from there we decided to really see what else we could do, because obviously we were just scratching the surface. And the development of Healthy People 2020 has given us that opportunity. The things that we did after we made the progress in clinical prevention and population health area was to look at undergraduate public health, which until recently has not existed. But in 2003, the Institute of Medicine recommended undergraduate public health for all undergraduates. And that's given us an opening to develop the Educated Citizen in Public Health Initiative. And today we are seeing, as part of 2020, objectives to develop majors and minors at 4-year colleges and associate degrees and certificate programs at 2-year colleges. And so Healthy People 2020 has allowed us to really put on the national agenda efforts to really develop undergraduate public health and hardwire it. So we've moved from there and developed interprofessional education efforts. We're trying to connect it with K through 12 education. And so what the Education for Health framework is, it's a framework to look at pre-K all the way through clinical graduate education and try to bring a coherence to that education that allows us to really develop throughout the educational spectrum the opportunities for people to build on what they've learned, to develop a coherent approach, and to hopefully come away with a real lifelong commitment to public health and to prevention.
Wow, that makes me want to just stand up and shout.